Hello, and welcome to the Taking Care of You podcast. I'm your host, Lesley Cantu. This podcast is all about sharing information and resources for students, faculty, and staff to stay safe and support their well-being. On today's episode, we sit down with a health educator from Stan State to talk about a topic that is crucial for every student's well-being, the Student Health Center. From services offered to their importance in campus life, we will explore how the Student Health Center and the Health Education and Promotions Program play a vital role in supporting students' physical health and well-being. Whether you are a current student or just curious about what our Student Health Center offers, you won't want to miss out on this insightful discussion. So let's get into it. Welcome to the podcast, Taylor.
Thank you. Thank you for having me today, Lesley.
Of course. Is this the first time you've been on a podcast?
Yes, it is. And so I'm very impressed with the setup. I've always seen podcasts on Instagram with the headsets and the fancy microphones. So I'm feeling real special right now because I've never been in a setup like this.
Everything's so fancy.
It really is.
So you're here to talk about the Health Center and all the resources that come along with it. So let's get into it.
Sure.
How long have you been here at Stan State and what is your current role?
I have been at Stan State since 2016, and my current role is a health educator within the Health Education Promotion Office in the Student Health Center.
How did you come to work in the health field, and what inspired you to join our campus community?
My previous job was working with a lot of wellness wheel dimensions, and I became really passionate about all things health and wellness, whether it was chronic disease prevention, tobacco prevention. Being able to see that working with middle schoolers, I really became passionate about how to work with students in their young adult phase. Because in middle school, they're still forming their behaviors and things. And I thought it would be really inspiring to work with college age students who are able to take those behaviors and knowledge and make it into tangible changes into their life versus middle schoolers still have some barriers in terms of what they can do with their health and things. But I wanted to focus on the college health population.
Can you give us an overview of the services offered at the Student Health Center?
Sure. The Student Health Center is a fully accredited medical facility. We offer things like primary medical care, sexual and reproductive health care. We offer telehealth appointments. We have an on-site pharmacy and on-site laboratory. We do athletic, travel, and employment physicals. We have free TB testing, immunizations, including flu vaccines. We also offer free naloxone and fentanyl testing strips as well.
What is the cost of this? Is there a copay? What's the affordability look like for these services?
So we don't do anything with insurance in the Student Health Center. And most students are automatically eligible for healthcare at Stan State in the Student Health Center because of the university tuition and fees. It's a mandatory student health fee that covers the visits and services at the health center. So there are minimal charges for certain things like physical exams that might have a laboratory test or pharmacy items or specialized radiology services attached to it. But when students are calling to make an appointment, they can talk to the health center and see what their services will be that day and can gauge if there will be a cost for anything and kind of a ballpark range for things. But you will find that it'll be low or no cost healthcare. So we often say that it's the best healthcare deal in Turlock.
That's amazing. And it's good to get an estimate beforehand going into the bare bones. How do students make an appointment or what is the routine to doing that?
Sure. Students can schedule an appointment. They just simply have to give us a call at 667-3396 and they can make an appointment. It's super easy, super fast. And so give us a call today if you haven't seen a doctor in a while, if you need a physical, if you need a TB test, we're happy to service you.
How does the health center collaborate with other campus departments and organizations?
We see personal health intersecting with so many different departments on campus, whether it's our CAPS department, basic needs, campus recreation. And we know through our American College Health Association's National College Health Assessment data where our students are doing well and where we might need a little bit of improvement in terms of our health and wellness areas of focus. And so we'll partner with CAPS on things with suicide prevention. We'll partner with campus recreation. We've done inclusive movement challenges. We've done sleep challenges. And we'll partner with our different departments like housing and basic needs for finals care package kits to provide students with things like index cards and pens and little goodie snacks to get them through their finals and do that final push to finish out the semester warrior strong. So we partner with a lot of different campus departments like the Learning Commons for study tips or adult coloring to de-stress during finals. So we love partnering and collaborating with different departments on campus because we know that health and wellness intersects with everything from their academics to other areas of their personal health and wellness.
I think I did see one of those posts about the little goodie bags, and I got one last semester, and it really just brightens up your day as a student, just going into finals, being able to know that you're getting the materials or even just that pick-me-up right before finals. And how does the Student Health Center support both physical and mental well-being?
So we encourage students to come in for preventative physicals. If you haven't seen a provider in a while, we definitely encourage that. And our providers can offer great information on physical health, chronic disease prevention, things like that. And mental well-being, we partner a lot with our CAPS department. And so there's a lot of referrals that happen back and forth between CAPS. We know that our physical health is just as important as our mental health because everything is connected. So we treat everything, mental health, physical health, emotional health, all very important priorities for us.
So let's jump back into students making an appointment. When students come in, we want to make sure about confidentiality. So what steps does the Health Center take to ensure confidentiality and privacy for students?
We definitely want students to know that we prioritize their confidentiality and their privacy all the time. And so their students' medical records are strictly confidential and completely separate from any academic records. So no one from the university, faculty members, or staff can see anyone's medical records without their written consent. If students are 18 years or older, parents cannot access those medical records either without written consent. So we take things like HIPAA and everything very seriously. So we want all of our students to know that their medical records will always be kept confidential. So they definitely don't have to worry about anything like that within the Student Health Center.
With that being said, there's a variety of unique health needs and concerns with diversity in students. How does the Health Center address those unique health needs?
We always want to make sure that we are being inclusive with our healthcare. So certain things that we'll do when we do our annual training, we'll have sessions and speakers about gender affirming care, how we can make sure that we're always being inclusive for all of our students and all of their identities. So we want all students to know that their identity matters to us and that they will always be treated with respect within the Student Health Center from the providers. And that we encourage everybody, especially if they've had a negative experience with a healthcare provider, don't be shy from, when we apologize if that has ever happened to anybody that they've had a negative experience. But we want everyone to give us a try and let them know that we will always value their identities, what's important to them, and then be able to provide them with quality healthcare.
So you've been here since 2016, which means you have seen a lot over the years. How did 2020 with COVID disrupt the system of the health center or how the progress of it went about?
Something that we implemented during the time of COVID was our virtual appointments, our telehealth appointments. And that's something that we actually weren't offering prior to COVID. And so if there is a silver lining during COVID that we were able to find within the Student Health Center, it was being able to offer virtual appointments for our healthcare appointments. And so it's something that we've continued to do post kind of coming out of the pandemic. And students have really enjoyed being able to access their healthcare providers if they're living far from campus, not coming to campus that day, and just privacy in general. Students have really given us a lot of positive feedback about being able to connect with their provider, get refills on their prescriptions, and not have to come physically into the health center. And so that's something that changed for us during COVID.
And then going back into the general health services, can you really go into details about what students can be seen for here at Stan State?
Sure. So if students are, again, if they haven't seen a provider in a while, we really encourage students to just come on in for a checkup, a physical. If students have a pre-existing condition, we highly encourage them to come in as well and meet with a provider so that we can help them if they are having a situation, a flare-up or something that they're already on the caseload. There's already notes about that patient. We can help them a little bit faster than if they're coming in for the first time. We also offer anything with general health concerns. Mental health consultations are really popular within the Student Health Center. And again, we partner a lot with CAPS for mental health referrals. And so we definitely pride ourselves on understanding and the importance of mental health. So we always want to destigmatize any negativity surrounding mental health and let students know that mental health is so important and we want to talk about it and normalize having those conversations, normalize coming in to talk about mental health, and always promoting CAPS as well. That's a great resource for our students. We do offer a lot of sexual and reproductive health care, things like the medical abortion services. Right now, I'd say our naloxone and fentanyl test strips are really popular as well for students to be able to have access to those because that's so important.
And if students are already seeing a different provider and they would like to come to the Student Health Center, are you able to access those records? Say if they have Kaiser Permanente, would you be able to access so that way you have a full medical history, or would you just get a general examination there?
I don't think so. So I think what would happen is, if a student is seeing a provider at Kaiser or another medical facility, we would want to encourage students to come into our facility as well, because if they want to see that provider on the weekend or on a holiday closure when the student health center isn't open, we would want them to still have communication with that provider. So sometimes we get asked if students do have health insurance, if they should drop it when they come to Stan State. And I wouldn't, just because there are times that, like holiday breaks or summertime breaks, if students are not commuting and they're living on campus and they go home for the summertime and they don't have access or would be inaccessible for them to get back to campus to see a provider, we would still want them to have access to their other providers.
And speaking of availability and hours, what are the hours at the Student Health Center? When can students go be seen, especially during summer, winter breaks, when that happens?
So right now we're still on our regular hours. Patient care is Monday through Friday, 8:15 to 4:45 p.m. Our pharmacy is open 8:30 to 4:30, Monday through Friday. The pharmacy is closed every day from 11:45 to 1. So if you're thinking about picking up a prescription or need to pick up a prescription, maybe work around your lunch time and don't try to do it during your lunch break. We progress to the end of the semester, move into summer hours, and we'll be on the summer hours like a lot of other campus departments where we'll be 7:30 to 4.
And then are you guys open during winter break?
Yes, we are.
So me personally, I have never even walked into the health center. So hearing all of these things that are available is just really interesting. And there's been times where I've been needing to get lab work done, and I just can't do it with my providers. So I had no idea there was a laboratory on campus. So can you tell me a little bit more of that, what that offers, and what kind of tests you guys do?
Sure. Well, first of all, you're welcome anytime to come in and meet with a provider. And then for our lab testing, it's super convenient. Our students love that they don't have to drive off campus and go to a separate facility for their lab work. I know a lot of times when you're getting your lab work done at a Kaiser or a Sutter Health, you either have to go to a different room or a different building. Ours is right within the same Student Health Center building, and so it's super convenient for students. Things that can be done in our lab would be like complete blood count, urinalysis, strep throat testing, pregnancy testing, our sexually transmitted infection testing. We do a sexually transmitted testing infection bundle every October and April as well. And we offer all of those for free versus each thing would be its own price and own bundle. But we bundle it all so that students have access and don't have to worry about a financial barrier to being tested. We want all students who are sexually active to be able to get tested and normalize having that conversation. We want to destigmatize what like STI testing looks like to people. And we want all students to know if you are sexually active to make sure that you're taking precautions to take care of yourself, like getting your STI testing bundle taken care of. We also offer immunity blood titers like glucose, lipid, thyroid tests. We can pretty much do anything for you in the lab. So if you haven't had your labs done in a while, Lesley, and now is a great time to come on in to just get checked out, get a physical, and get all your lab work done.
That'd be great. I definitely need to get my lab work done. But going back to the STI testing, it's definitely a big thing that we should be destigmatizing and making sure that safe sex is a part of good health. And so with the health center, what are the steps that you guys take to kind of promote safe sex and health? Is there condoms available? Is there birth control available? What options are there for students on campus?
Sure, that's a great question. The reason why we do a lot of sexual health programming is because based on our National College Health Assessment data for Stan State students, we know that over 50% of our students are sexually active. So we, of course, respect anyone's decision on where they are, the sexual health spectrum. We follow the CDC kind of spectrum of sexual health, which would be everything from abstinence, knowing that that's the only 100% way to prevent STIs or unplanned pregnancies, but all the way to people who are currently engaging in sexual activity to make sure that they are taking proper steps to take care of themselves. So in addition to the STI testing bundles, we also offer safer sex kits, and they have some information even talking about like condoms expiring. And so students might know the proper steps to using a male condom, but if it's expired, it's already going to be not as effective as students would hope or would be anticipating. We have some information in there. We have lube, dental dams, things like that. We'll offer our safer sex kits when we're tabling in the quad. We also offer them for free in the Student Health Center lobby. So when you come on in, you don't even have to ask anybody. You can just take them because they're free and you don't have to go up to the window or anything like that. So again, we really want to destigmatize what that looks like and make sure that people are taking care of themselves and practicing safer sex practices.
That's definitely an amazing statistic that I want to get back to, but I'll circle back to that later. When it comes to the laboratory testing and the results, how long will results take, or where can they find their results?
So students will be able to access their results on their My Health portal.
With the general health services that you guys offer, when on a college campus, it's very common for flu season to spread. What kind of immunizations do you guys offer in the Student Health Center?
We definitely offer the flu vaccine every year when it becomes available to us. We do the measles, mumps, rubella, hepatitis A, hepatitis B, tetanus, HPV vaccination as well.
Can you tell me a little bit about the health education and what the Student Health Center does for that? Is it a program, or is it just general knowledge? Is it trying to get information out to students? Can you tell me a little bit about health education?
So the Health Education Promotion Office, we really want to lead health education initiatives and advocate for health promoting campus community for our students to be able to flourish academically within their wellness. We know the intersectionalities between individual personal health and wellness and academic success is so tied together. We know that if you are not taking care of yourself, if you are not, as a student, being able to sleep well, have food security, if you are not able to eat nutrient-dense foods, that working on that history paper or studying for that math test is going to be that much more difficult. And so we really want to hit home the importance of things like nutrition, physical activity, positive coping mechanisms in terms of stress management. So rather than turning to something that would be negative behaviors, we really want to encourage students to think about things for stress management like yoga or taking a walk, adult coloring, talking to someone at CAPS, instead of doing something that would be like negative behaviors or detrimental to the long run, things that might be easier or seem like a really good stress reliever at the time, but might not be the best for long-term health for somebody.
And that's amazing that we get that information out, especially to incoming students that may not know all these resources, or even if some students don't have any idea. I know there was a lot of things that I didn't know. And even just from what you've been saying is so informational and so important that we're touching on these topics. And I know we talked a little bit about confidentiality, but if we could just circle back to that again, I know that there might be some students who are a little discouraged because maybe they do have an alcohol or other drug problem. Can you kind of show us how you deal with situations like that with confidentiality and making sure that students feel welcome?
Again, our confidentiality for students is our utmost priority. And we would never want students to feel judged. So we want students to be able to be honest with things like alcohol use or drug use so that we can gauge where they're at with their personal health. So the last thing we'd want is for students to come in and feel like they can't be honest with us, or that they have to even lie about like how much they're actually drinking or how much they're actually using, because we want to know that information to help them to better it. So it would never be a provider asking in a judgmental way. It's more of a way to gauge where they're at currently, so that we always talk about meeting the students where they're at. So same with healthcare. We want to meet you where you are. And so that means we want to know for real, like how much are you actually drinking? How much are you actually doing that? How much are you actually sleeping, right? And so there's no judgment from the providers, but it's really just so that we can get to know you a little bit more and help you.
And with them coming forward and being comfortable, I know what runs through a lot of people's mind is this going to get me in trouble? Especially on a college campus, especially with a college resource like this. Is there any tie to possibly getting kicked out of school for drug use or alcohol use? Just things that students might be worried about?
That's a great question. But the answer is all of the Student Health Center employees, providers, everyone is a confidential resource for students. So that is including like Title IX issues, anything with thing for information that students and patients reveal to the providers. All the health center employees are confidential resources for students.
That's amazing to know. And how can students reach out? Like, what's the contact information? Is there any, I know we had talked about the hours. Is there anything that they can use for outside hours that's a good resource for them to use?
Definitely. So when the Student Health Center is closed in evenings, on weekends, we definitely encourage students to utilize the after hours nurse advice line. And this is an 800 number. So it's 1-800-258-1625. This is a resource available to students in the evenings. It's like 5 p.m. to 8 a.m. on weekends and holidays. When you call, you do have to have your student ID number ready, because that's how they'll know that you're eligible to utilize the nurse advice line, because your student ID number will show that you're a student.
And I know this is for general students, but are student athletes able to use the Student Health Center for physicals or injuries that they've suffered through their sport?
Yes, definitely. So we offer a wide variety of sport medicine, general health services. And we have one of the providers, Dr. Javon, focuses a lot with our student athletes. So a lot of our student athletes know Dr. Javon and he knows a lot of them. And so there's definitely something available, readily available for our student athletes to come on in if they haven't already been so.
I love that part of the Warrior family, keeping it close-knit. So with everything that the Health Center has to offer, are there any new programs or initiatives that the Health Center plans to implement in the near future?
Sure. So we're reviewing our latest National College Health Assessment Survey data that we just received in. We administered this in March. We already have our data in. And so we will use the summertime to really think about how we can be intentional with our programming and our planning to help best meet the needs of our students. But we know, for example, the top 10 academic impediments for students. I'll just go over the top 5. The number 1 is procrastination. And that was similar to the last time that we administered this survey. And so what we do is try to do a lot of workshops on time management, partner a lot with the Learning Commons on study tips, partner with Campus Rec, housing, basic needs on the study care final packages like you talked about, the goodie bags. We know that stress is our number 2. And so working on stress management, positive coping mechanisms for stress. We know that stress is always going to be in our adult lives. We know that college is a stressful time. Midterms, finals are stressful times. We know that we can't necessarily alleviate that, but how can we reduce those stressors, right? What can we do knowing that finals is going to be a busy week? What can we do knowing that midterms is going to be not the best week to take on extra shifts at work or to volunteer to help our families with a lot of extra commitments? So what can we do in terms of positive coping mechanisms that are easy to implement into our life that we can have kind of those tools in our toolbox? Anxiety is our top 3rd academic impediment. Finances is number 4, and sleep difficulties is number 5. We've seen sleep difficulties for our students in the past, and we actually did some sleep challenges with campus recreation as well, just understanding the importance of sleep for muscle recovery, but also brain recovery too for students. When you're studying, you need to have that sleep and be able to get a restful night's sleep to be able to work the next day. When we talk about sleep in health education promotion, we always say that sleep is so essential, and you would never expect, your phone to not charge overnight, but then be able to power you through the whole day. You wouldn't be able to watch TikToks and creep on people on Instagram if your phone was dead, right? And so think of your body the same way. It needs to be charged just like your phone needs to be charged, just like your Mac and your iPad need to be charged. So we really want to encourage the importance of sleep and how vital that is for our brain and muscles.
I love that comparison. I never realized how much the Student Health Center is so involved with other programs. Like I never thought that it was involved with the goodie bags, or I would assume that you guys are close with CAPS and the Learning Commons, but I always assumed that they're doing their own thing. But it's good to know that they're actually doing these things and helping these students with how can students get involved if they want to get involved with the Student Health Center.
We have different avenues. Students have done things with academic programs with us, whether it's internships. We have some great opportunities for students who are more interested in getting involved. Our Student Health Advisory Committee, also known as SHAC, is something that students can volunteer to be a part of. And it's a really great way for students' voices to be heard. If students are coming to us and wanting a change or wanting to know why certain things cost a certain amount, they're able to be kind of the advisory board, speak on behalf of students, and be able to have direct contact with the Student Health Center director and bring those concerns that they have straight to her, and then able to meet kind of as an advisory board in that capacity and be able to discuss how things might be able to compromise or what we can do to help students understand things or maybe make changes if that's where we want to go, the direction that we want to go into. We also have our Peer Health Educators. Both programs are volunteer-based programs for our students. And the Peer Health Educators are similar to SHAC students, but a little bit different. SHAC students, again, being a little bit more advisory, kind of guidance driven. The Peer Health Educators are out in the quad promoting things like the dietary guidelines and My Plate and how to eat healthy, or physical activity guidelines, working with Campus Rec and promoting our inclusive movement challenges when we do those. So similar work, but a little bit different. We've had students in the past who have done both as well and sat on both committees in both programs for the Health Center.
And how do students become involved with SHAC and Peer Mentor?
Sure, they can go on our website, which is csustan.edu/Student Health Center.
We'll go ahead and put that in the description for those who are interested in joining SHAC and Peer Health. With these students getting involved, I know it's not very much the same, but do you get a lot of nursing students, or has there ever been a cross between nursing students wanting to come back and help out with STAN and the Health Center? Have you heard any success stories like that?
We do have a lot of crossover with that. We've partnered with the nursing department before for like our flu vaccines and flu clinics, things like that. With the way that our health center is, and again, our priority over privacy, confidentiality for students, we don't have anybody from nursing or any other departments who students that would be like in the back working with like doing their clinical or hours or volunteering in the back. Again, because we prioritize student privacy and confidentiality so much with HIPAA and different things. So we don't have any opportunities for students to be kind of in the back or anything like that. But we do have students that have come back after they've graduated. Sometimes they're here at NSOs, like with their kids and sending their kids off to become the next warrior. And they'll say things like, the healthcare that I received when I was a student was the best healthcare I received. And so to hear those kinds of positive feedback and that anecdotal feedback from alumni is always so great to know that we are a trusted name in healthcare.
With the Student Health Center being so involved with students, are alumni or faculty and staff available to use the Student Health Center?
That's a great question. The Student Health Center is funded by the mandatory health services fee. So our population is just current students, currently enrolled students. So unfortunately, we don't service alumni or faculty or staff at this time.
I think that's really important to know that it's a mandatory student fee. So if we're already paying for it, we should be using it.
Yes, that's something we try to promote a lot at the NSO orientation, the showcases, so that students know, so that we can be transparent about what's going on in your tuition and fees. And students should be able to know what they're paying for. And so we want to encourage people that you are paying for this within your tuition and fees. So like you, feel free to come by anytime for an appointment, Lesley.
I definitely will. What advice would you have for students to make the most out of the resources and services provided by the Health Center? So say if they're coming up to your booth at NSO, what would you say to them?
Sure. I think any experience, but especially in college, is what you make of it. So we have students who we know are really busy and commuter students who really just want to come here, get their classes done and go home, go to work. And that's their experience, right? That's the experience that they want. And that's the experience that fits their life. It's conducive to their daily schedule. But if students are wanting to take advantage of the resources, services, programs on campus, we really want students to be aware of what resources we do have on campus, like the Student Health Center, things that they are paying for within their tuition and fees, and then be able to get the most out of that, of identifying what they want out of their college experience. Do they want to be able to utilize the services that are in existence? If students are like, oh, I'm already happy with like my provider in Modesto or things like that. But we want you to know that you have an alternative option here on campus. It's probably a little bit more convenient. It's probably going to be a little cheaper. So we just want to encourage you to step out of your comfort zone. And even if you're feeling like you already have a great relationship with a provider, just go ahead and come on in for a checkup, a physical, just so that you have another option, because maybe there'll be a day when you're not feeling well and it's too rainy and you're just not feeling well enough to get to your provider in Modesto, and you're already on campus anyway. And we have a great team of providers that can help take care of you without you having to lose your parking spot or deal with traffic. And then you can go to in between classes. Super convenient.
What is the most important thing about the Health Center? Why is the Health Center so important?
I'd say the most important thing for the students to know about the Student Health Center is that we are a fully accredited medical facility. And so we are not just a first aid Band-Aid clinic. Sometimes we'll be at events and students will say like, oh, I thought we could only just get Band-Aids from you. I didn't realize you had a lab or a pharmacy on site. So the most important thing I want students to know and take away from this is that we are a fully accredited medical facility. So again, we can see you for general health services, primary medical care services, sports medicine, mental health consultations, sexual reproductive health, free naloxone, fentanyl testing strips, free TB tests, and not just Band-Aids. Of course, we do have Band-Aids too, but we also have a wide variety of other healthcare services.
You guys are definitely not just Band-Aids. Is there any other information that students should know about the Health Center that we haven't talked about?
Yeah, definitely. I don't know if I talked about the My Health web portal, but students can access that. And that's the online health portal for students. You can message your providers. You can upload your immunization records. You can request prescription refills. And you can also review your lab test results right there with the My Health portal.
How do you envision the future of the Health Center evolving to better serve the changing needs of our campus community?
So we definitely pride ourselves on being data-driven to help meet the needs of what our student demographics looks like. So we'll spend the summer reviewing our National College Health Assessment data, seeing where our students are doing really well with their health and well-being, and seeing where our students are lacking in certain areas. And we'll do programming to provide more resources, more information and education to students in areas that we feel their percentages are a little bit lower than we would like to see, and really promoting things like our sexually transmitted testing infection, our STI testing bundles, free resources and education for students to help them live their best life with the healthcare.
Thank you, Taylor, for sharing your expertise and the resources students have from the Student Health Center on campus. I would like to end the podcast with just a simple question. What is something that you like to do personally to take care of yourself?
I think personal self-care is so important, and people should do self-care in a way that makes sense to them, that's enjoyable to them. And so for me, one thing we like to do in the Student Health Center is take short breaks that are exercise breaks. So earlier this morning, we did like a 10-minute weight break. And so I enjoy self-care that's throughout the day, whether that's making sure you're doing your hydration breaks, your stretch breaks, working out, eating really colorful, pretty like Instagram type meals. And so I think something that I like to do to take care of myself is little things every day, little like decisions or little behaviors every day throughout the day that make me feel like I'm taking care of myself and being proactive with my health. You know, things like getting seen by a provider, Lesley, who needs to come to the health center, and making sure that I feel good about myself so that I can feel productive.
Gotta love the Instagrammable food. Thank you for coming onto this podcast and giving all the resources and letting the students know that the health center is not just a place for Band-Aids. They have Band-Aids, but it's not just that.
That's right. Thank you so much for having me on today. I appreciate it. And we're happy to answer any questions that students have. Just go ahead and give us a call, and we'll be happy to answer any questions and schedule appointments for anybody.
Thank you for listening to this episode of the Taking Care of You podcast. You can listen to this episode and past episodes at csustan.edu/podcast or on your favorite podcast platform. Be sure to subscribe and follow to be notified of any new episodes. Stay safe, warriors, and take care.